RSV, which stands for respiratory syncytial virus, is a viral illness that causes lower airway infections. And in babies or kids less than 2, this is known as bronchiolitis. It's called bronchiolitis because the small parts of your airways are the bronchioles. And so bronchiolitis is inflammation of the small part of the airways. In older people who have larger airways, usually RSV is just a head cold. But in younger children, it can cause significant problems with obstruction of those small airways, and that can lead to problems breathing. In addition to the breathing problems, we can see coughing, runny nose, wheeziness, fussiness, fevers. This tends to peak in most areas in the winter, so it starts in the fall around October, and then usually peaks around December to February, and then we start to see it trail off in March and April. RSV is definitely one of the more contagious viral illnesses that we know of. There's pretty good evidence that by the age of 2, almost all babies have been exposed and infected with RSV. One of the reasons it's so contagious is because it's spread via our respiratory droplets. So whether we're coughing, we've got some sputum, we've got some mucus from our nose, but part of what makes it so contagious is that it can actually live on surfaces for several hours after it comes out of your body. Using a disinfectant like a Lysol that has, 99% activity against viruses and bacteria will help reduce the risk of spread on those high-risk surfaces. The other thing that makes it pretty contagious is that the period of viral shedding actually lasts for quite a while. So after somebody starts showing symptoms, they can spread the virus for days afterwards. Some people say anywhere from 8 to 11 days of shedding the virus is around average. Nobody should be visiting your baby if they're sick. Obviously, people with fevers, cough, runny nose really shouldn't be holding your baby. If they are sick, wearing a mask, making sure we're washing our hands before we pick baby up are really important. So even though the disease itself is really common, severe disease or complications from it are relatively rare. And babies who got the RSV injection had 70% less usage of medical facilities compared to babies who did not get the vaccine. I hope you never feel like you can't call your pediatrician and ask them questions or get an appointment, because really at the end of the day, that's what we're here for. Bronchiolitis is our bread and butter. So if you're worried about your baby or you have questions about RSV, we're always here and happy to answer them.